when we talk about what kind of got me started in healthcare, Mom always wanted to be a nurse. She never got an opportunity to pursue that career, but she always wanted me to do something in healthcare. And so as I got older, she kind of pushed me more towards being more interested in science and math. And my mom always wanted to make sure that I was thinking about being a working woman as I grew up, and which was really kind of groundbreaking for, that period of time. And my dad was an entrepreneur, started businesses and so forth. So he always kind of pushed all of his kids towards, I didn't have a chance to go to college, you all need to go to college. And then in high school, I was given the opportunity to volunteer at Byron Health Center in the physical therapy department, and I was hooked. Physical therapy just checked all the boxes for me. I got an opportunity to work one-on-one with people. I got a chance to teach people. Evidently, I made it look attractive because I have a daughter who's a physical therapist as well. And she told me in kindergarten that she wanted to be a physical therapist. And so it truly is kind of a calling. You just go there because that's what was right. Life changes being what they were. I left Fort Wayne. The joke was at one point in time I could practice from Canada to Cuba because I had a license in every state down 75. And then came back to Fort Wayne in 2001. Parkview was getting ready to build a new hospital called Parkview North, and that's when I came back to Parkview. Knowing then that, I had all of this experience behind me, I was always kind of looking at what's the next thing? How can we make this better? I took advantage of as many things as Parkview was willing to train me on. And the other piece that was kind of a skill that my dad taught me was when the door opens, walk through it. So I just had kind of this progression of going from supervisor to manager, then manager to director, director to system director, and then that system director to VP. So yeah, it's taken 20 years, but when the opportunity presents itself, you just have to say yes. My leadership philosophy is let your experts be experts. Do whatever you can to facilitate their work. It's that old Walt Whitman saying, or Ted Lasso. First, you be curious before you become judgmental. When I say, so help me understand, ... It's kind of like, uh-oh, Gail's asking questions again. But that's changed my leadership style. From when I was in private practice, I was kind of a benevolent dictator. You just did what I told you to because it's my business. I had to completely change that style as I moved through Parkview. I think that both of my parents, but especially my dad, would be extraordinarily proud. One of the things that my parents imparted to me was a deep love for the community that I live in. I was always told that if you're whatever community you live in or that you're a part of, you need to participate in and you need to raise the level of that community whenever you can. And that's kind of the way I feel here. That's what I love about Parkview. We participate. We are part of the community that we live in. And there's not a lot of health systems that are like that. We are driven by the people that we live with. And I just find that extraordinarily special about. And that's why I'm still here. I love what I do and I love our mission.